Merci, Monsieur le Président. C'est un grand honneur pour moi de prendre la parole aujourd'hui comme témoin sur le projet de loi 442, mon projet de loi pour une stratégie nationale pour la maladie de Lyme. Ce projet de loi a été conçu dans une optique non partisane pour aider les gens de partout au pays. Et j'espère qu'avec un esprit non partisan, on peut continuer et pour réussir pour mettre sur pied le système dans le projet de loi. Le projet de loi établirait un cadre de collaboration entre les ministres fédéraux, provinciaux et territoriaux, de même qu'avec des représentants de la communauté médicale et de regroupements de patients afin de résoudre le défi de poser un diagnostic rapide et traiter la maladie. The spread of Lyme disease is something that I think all members are now quite familiar with the fact that it's spreading across particularly southern Canada. I have to say, as I just mentioned in French, that this is a very nonpartisan effort, and I am enormously grateful to all members and all parties represented in the House for support for this bill. And I have to say the top of my list for thanks is to the Minister of Health, Rona Ambrose. I know her officials will be coming in the second part of the Health Committee's review of the bill. Let me just explain what it is that I hope my bill will do, and then talk about some of the supporters that we have for this effort, because the support both politically and from the expert medical community is quite substantial. And of course, Lyme disease patients from coast to coast have been extraordinary in their support and in reaching out with petitions, which I think many of you have tabled in the House on behalf of your constituents in support of the bill. I have to say, of course, as any of you will know as members, when you set out to write a private member's bill, you're very aware of the constraints. The constraints being it has to fall squarely within federal jurisdiction, obviously, and that it should not attach itself to any measures that involve spending money. That said, I know that the Minister of Health would like to have some amendments made. I want to get that out right away. From my point of view, the amendments that the ministers or the health department officials will bring to you, certainly the ones that I've been consulted about, are absolutely fine. I tried very hard. I call this a national Lyme disease strategy. It may work better in terms of avoiding any treading on provincial jurisdictions to call it a federal framework or something like that. I'm not prescriptive about what the minister brings forward, obviously, but we do want to make sure that it doesn't tread on provincial jurisdiction. That was my intention in drafting, and to any extent that I failed to do that, I want to make sure that the bill is a purely federal effort that engages the other jurisdictions in a collaboration. So that's the first thing to set out, that the effort is to make sure that the federal Minister of Health takes the lead, but that the engagement is truly across provincial boundaries in a way that's respectful of jurisdictional limits. In that vein, I'll let you know that I was amazed to discover that just recently in the province of Nova Scotia, a bill has been tabled that will mirror this one. In the Nova Scotia legislature. So I think that might be the beginning of what we'll see across the country as more provincial jurisdictions are aware of the spread of Lyme within their own area. Now, it also has to be said that credit to the Health Canada that since 2009, Lyme disease has been a reportable illness. Now, that's quite a lot of progress, because there was a time decade or so before that, when you would be hard-pressed to find a jurisdiction that thought Lyme disease was a serious problem. I mean, there's horror stories. The first person I knew with Lyme disease was a neighbor in Nova Scotia, Brenda Sterling. She's very prominent in the movement, so I don't mind mentioning her name. But when she first contracted Lyme, she kept trying to talk to provincial authorities in Nova Scotia. She said, well, we don't have Lyme disease here in Nova Scotia, so therefore you can't have it. And imagine the change that's occurred, that the Nova Scotia legislature has now, as I said, there's a bill before the Nova Scotia legislature that mirrors this bill exactly. Okay, so what will this bill do? The minister under this bill will be required to convene a conference. Now, my bill says within 6 months. The timing around that might change in terms of government amendments. I don't think that's material as long as it's clear that it must happen. That the minister will convene a conference of his or her provincial and territorial colleagues in the departments of health, as well as representatives of the medical community, as well as representatives of patients groups, and that group will work together to develop a strategy. Now, there are several key elements of what's missing for the best possible approach in Canada to this illness. One is we lag behind the U.S. in terms of awareness for prevention. When people go out on a hike, and I was talking yesterday to the cameraman from CBC who interviewed me on this, and he's a volunteer, said it's his second job, he loves it. He's a scout leader. He takes the kids out in the woods. They've really ramped up their own awareness for tick awareness, for checking each other for ticks, for making sure we want people to enjoy the outdoors. We don't want people to get phobic about going on hikes and being outdoors. But the awareness to say tuck your pant legs into your socks, to check afterwards to see, have a friend check to see if you've picked up a tick, and then to know what to do if you have. Awareness and prevention are key. The next piece, which is much more complicated, is the diagnostic piece. And in the letter of support from the Canadian Medical Association, which will be tabled with you in both official languages at your next hour's hearings, and I've checked that with the clerk, and that appears to be fine to do. But the president of the Canadian Medical Association, Louis Hugo Francescuti, had this to say. He said, "Diagnosis of Lyme disease can be difficult because signs and symptoms can be nonspecific and found in other conditions. If Lyme disease is not recognized during the early stages, patients may suffer seriously debilitating disease that may be more difficult to treat." Close quote. So finding ways to share best practices across jurisdictional lines between members of the medical community so that there's a shared understanding of best practices for diagnosis. Because as the Canadian Medical Association has noted, with quick diagnosis, treatment is excellent. It's usually a course, a round of antibiotics, and patients return to full health. On the other hand, as with my friend Brenda Sterling in Nova Scotia, left untreated, it's debilitating. And when I met her, she was already in a wheelchair, and I was shocked at the time to discover she was in a wheelchair due to Lyme disease. Now, the next piece, of course, is better treatment and management, and that, again, through sharing of best practices within members of the medical community, and finding a recommended national approach that will reflect best practices for treatment of Lyme disease. Now, all of the materials that can be shared are described in the bill so that there's a public health aspect of this to increase the awareness, to help the medical community with the treatment and management of this disease. And the bill goes on to describe the ways in which the Minister of Health will, in an ongoing fashion, share information and help the medical community, provincial and territorial colleagues work together so that the spread of Lyme disease does not represent a significant threat of permanently debilitating illness to Canadians when it's easily treatable if properly diagnosed, and also there are ways to avoid contracting the illness by being aware of ticks and tick bites. This is pretty straightforward. I just want to stress one thing about the illness. We know that it is underreported in Canada. How would we know this? Well, in the United States last summer, in 2013, the Center for Disease Control and Prevention in Atlanta, Georgia, based on their understanding of the disease in the United States, increased their estimate of the prevalence of the disease tenfold, from 30,000 understood cases to probably in the range of 300,000. We can assume the same is likely the case for Canada. Since tabling my bill, I've had literally hundreds of Canadians write my office with personal stories. And also, I've had health professionals, both nurses and doctors, contact my office and say, I know that in my own province of X, we only have X number of reported cases, but we think it's far higher. So that we're actually acting in a timely fashion. The Parliament of Canada is doing something really useful and helpful, and the Minister of Health in the lead can make a real difference in the lives of Canadians, those who are already suffering with Lyme and those who can avoid suffering with the steps that can be taken through a federal framework. One very last comment, Mr. Chair. This is not a case where parliamentarians should become doctors or think we're doctors or have the politics of the issue have any impact whatsoever on what the medical community decides around the issue. I think that's really important. In some cases in the U.S., there have been some areas where the medical community has felt that politicians went too far. I'm very grateful again that in Canada, the established medical community and organizations are very supportive of this bill. We're not doctors. We're here to work on public policy. And with that, I open the floor to any questions anyone may have.